Today's Small Business Saturday radio podcast is being brought to you by Noretta Family Medicine, cutting through the red tape of healthcare.
Good morning, Columbia, South Carolina, and to everyone who's tuning in around the Midlands, outside of the Midlands, even outside of the state. Welcome to Small Business Saturday Radio, where we celebrate local entrepreneurs and small business owners who are building our communities and making a positive impact on our economy. I am Tazima, the owner of Sunrise Artists in Bath and Body, located right here in 5 Points, and my co-host today, and many of you know her when I mention who she is. My co-host today is the founder of Noretta Family Medicine, Dr. Boylan, and today we're speaking with Dr. Greigory Seitz, who is the founder of Alive Physical Therapy and holds a BS in, how do you pronounce that?
It's kinesiology.
Okay, I thought that, but I didn't want to butcher the word, right? And you're going to have to tell us exactly what that is, too, so don't let me forget. Okay, kinesiology. From the Masters University and a doctorate in physical therapy from the University of South Carolina. Go Gamecocks. He has advanced training in selective functional movement assessment, which is SFMA. That's the acronym. We're going to talk a little bit more about that. And orthopedic manual therapy. Specializing in orthopedic conditions, he employs manual therapy, dry needling, which I really want to know what that is, functional movement assessments, and targeted exercises. So, welcome to Small Business Saturday Radio. Dr. Seitz, how are you today?
I'm doing well. Thank you so much for having me. I really
you
appreciate
sound so good on the radio. You got a really nice voice. You might want to come in and do a show. No, I mean, really, you have a nice voice. So, but me and Dr. Boylan, we're both going to be, talking to you about your passion, why you chose this as your career. So I'm going to start it off with what inspired you to start Alive Physical Therapy. And I'm even interested in, how did you come up with that name, Alive Physical Therapy?
Mm-hmm. So, I guess to start, the name actually came from my good friend and colleague, Eric Williams. Mm-hmm. He's a doctor of physical therapy I work with as well. We were brainstorming for a name. We're like, what should the name be? And he threw out the word Alive. And we like that a lot because our clinic is very faith-based. Faith is very important to us. Mm-hmm. And we believe in Christ and Jesus Christ, and we say we're alive in Him as believers,
right?
Putting our trust in Jesus Christ. So not only do we want people to be alive physically, alive,
because you don't want to do physical therapy on a corpse, right?
Exactly.
So
and to be more alive because they're feeling better, moving better, stronger, are able to do the things they don't want to do. But when we get the opportunity to share our faith too, or that's one of the greatest joys we have. So
you know what? That's an interesting backstory because I didn't know that. So it's really, really beautiful too. So so that's how you came up with the name, which now is completely understandable. And I didn't even realize you were going to go in that direction. I thought you were just going to say, well, we want people to be alive.
And it's definitely kind of both, right? Spiritually and physically. Yes, ma'am.
Yeah, right on. So, tell me, what inspired you to even go into business for yourself? Because you could have easily worked there's like everywhere you ride, you'll see something that's like blah, 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 physical therapy, or you look in the, on the internet for, physical therapists and blah, blah, you know what I'm saying? You could have worked for the larger hospitals and everything. So what was it that made you think, no, I want to do this on my own terms?
Yeah, and I think Greg and I kind of share some similar experiences here with opening our own practices. So,
yeah. So, at least for me, starting out from a very young age, if you talk to my mom, I was the entrepreneur. I sold rocks in our front yard for 25 cents. The lemonade stand where the lemonade, did it taste good? I don't know. But the people who came were there to support, our entrepreneurial spirit.
Yeah.
So, I kind of always had that itch inside of me to start my own thing. and
it is an itch.
Definitely.
It really is, right? It's like it's there. It's always scratching too. And if you don't follow it, it's always there, saying that you need to carve out your own path. Yeah.
Yeah. And then, once I became a physical therapist, there's definitely various reasons I kind of started the clinic, but I guess, being able to control the whole environment was kind of the biggest deal for us, whether it's, being able to practice our faith in our clinic because we're in charge. That's a big one. Or, being able to see one patient at a time rather than 2 or 3 at a time, where productivity standards are just crazy, where they're seeing 3 patients at the same time as a physical therapist is very challenging. In most clinics, kind of, that's kind of a standard requirement for a lot of them. So.
Yeah, that's one thing that I've noticed in my direct primary care practices. Being able to focus on one person at a time just benefits that relationship so much, and is on both sides of the spectrum, both for patients and
in full disclosure, I have been a patient of Dr. Boylan, I think almost 15 years now,
probably close to it.
So I've seen the transition. But even when she was working in the system, there was something different about her for me. It was like she saw me and she could convince me to do things that just like, I'm not taking those high blood pressure, And so when she made the decision that she wanted to open her own business and ask if I would be interested and still being her patient, I was like, of course. And the reason for that is because I could tell early on that she was different in the way that she connected with people because of how she connected with me. And now, even in her practice, and here's a shameless plug again, Noretta Family Medicine, you can call her. There's times I'll just pick up the phone and call her, which is really important. I have a relationship with my doctor, which is really important. I can talk to her about those things that concern me, which is important. And I know I'm not just a number.
Yeah. Well, thanks. I really appreciate you
saying
that.
It's the truth.
Yeah, thanks. I will say it sort of sounds like I was always meant to do this, but the reality is that I was very, very hesitant. It took me years to make the decision to open up my own practice. So with Greg, with all these big, corporate owned physical therapy offices around, did you feel any sort of hesitation? Did you, how long did it take you to make the decision to do this?
Yeah, there was definitely a lot of hesitation. And getting ready and getting ramped up at some point, there was kind of like this leap off the diving board. It was like, hey, you can't, once you sign some documents, for example, our lease was a big one. Yeah. There's no turning back.
And that's the whole thing. And I think it's like that for most entrepreneurs. I don't know if it's 100%, but I think it's a high percentage. You are literally taking a leap, right? You are jumping. And the thing about it is that you're going to get beat up, bruised up, scarred up, scratched up. But if it's your passion, you're just going to keep doing it. So, yeah, that's part of it, you guys, being that entrepreneur. Take the leap. All right, we'll be right back in a few.
The City of Columbia's Office of Business Opportunities supports small business owners. We help minority, women, and veteran-owned businesses with loans, technical assistance, education, and advocacy. We're here to help business owners avoid mistakes. Contact us with questions and let us help. For more information, call 803-545-3950 or visit obo.columbiasc.gov. Together, we are Columbia.
Are you frustrated with the healthcare system and looking for a change? Then look no further. I'm Dr. Melissa Boylan with Noretta Family Medicine. We are a direct primary care office where we take the time to get to know you. For a reasonable monthly fee, we offer transparent billing and easy-to-access primary care for all ages. Noretta Family Medicine, cutting through the red tape of healthcare. Find out more by visiting NorettaFamilyMed.com. That's NORETA FamilyMed.com.
Are you looking for a luxurious way to pamper yourself? Look no further than Sunrise Artisan Bath & Body. Our plant-based soaps and lotions are designed to provide you with the ultimate experience. Our products are natural and nourishing, leaving you feeling refreshed and rejuvenated. So go ahead, treat yourself with Sunrise Artisan, which is more than a bath, it's an experience. Sunrise Artisan, located at 710 Saluda Avenue in 5 Points, or online at sunrisebath.com. Sunrise Artisan.
Looking for the perfect gift or a little something to brighten your day? Visit A Little Happy at 707 Saluda Avenue in 5 Points. Discover unique gifts, delightful accessories, and one-of-a-kind treasures, all carefully curated by our owner, Ashley Lindler. At A Little Happy, we believe in spreading joy through every item. So come on in, find your happy, and support local. Your next favorite thing is waiting.
This segment of Small Business Saturday Radio is brought to you proudly by A Little Happy in 5 Points.
All right, welcome back, everybody. You're listening to Small Business Saturday Radio. I'm Tazima, your host. Our co-host today is Dr. Melissa Boylan. Again, she is the founder of Noretta Family Medicine. We're talking today with Dr. Greigory Seitz, who is the founder of Alive Physical Therapy. And the conversation is already like just speeding right along, just finding out, what was it that gave you the courage to say, you know what, I'm going to go for it. I'm not going to have the safety net of working for corporate medicine or whatever it is that you guys call that institution, but that you want to carve your own path and you want to be able to spend more quality time with your patients as opposed to, like you said in the first segment, having to do physical therapy or 3 or 4 people. As a matter of fact, how do you do that? How do you do that? Like, when you were in that environment, that had to be so stressful, right? Because you're really wanting people to be good, to be okay when they leave. But if you've only got this limited amount of time, how did you deal with that?
Thankfully, I haven't personally had to work in that environment. The jobs I've had leading up to this, that wasn't a requirement for me, but it's standard in a lot of our practice as physical therapy. And to be fair to those clinics too, there are some patients that really are appropriate for it. If you have multiple patients, say for example with knee replacements, and they're all at the similar timeline of healing with all similar goals, there's certain types of therapy that are pretty straightforward. However, there's other types where it really, people really do benefit from having just some extra attention. Mm-hmm. And I, as a consumer, prefer that extra attention too. Mm-hmm. Even if I could go to a clinic where I'm working with 2 other people at the same time as a patient, I prefer that individualized care. If I'm paying a $50 copay, I'd rather go somewhere that sees me one-on-one for that hour for my $50 rather than the therapist's attention being split 3 ways for that $50 copay. Mm-hmm. So there's definitely a place for it, but we just choose to do it differently. So
yeah, that's what I've found too is people are paying for my services too, in my practice, and it's just that one-on-one attention, it just gets so much more accomplished. You can just, it really is personalized. It really is. You can go deeper, and I find that it's a huge benefit. So yeah,
no, I do, but I do.
Yeah.
So now I want to ask you about what is dry needling? What is that? What it's called? Dry needle. What is that?
So dry needling is kind of similar to acupuncture. Acupuncture is based on kind of Eastern medicine, whereas dry needling is based on Western, kind of a Western approach to it. I think the best way to kind of think about it, that I like to describe it, is think about when you get a splinter in your skin. What happens?
It hurts.
It hurts. What also happens, it gets a little hot, a little red, a little irritated. Well, if we can't get that splinter out, what happens? Well, it turns into a little pustule, a little almost like a zit. And eventually our body will be able to get it out naturally, right? And so the idea behind dry needling, one of the ideas is, hey, when I put a dry needle or an acupuncture needle into the spot that's bothering you, it's going to create this local response where blood is going to rush to this area and help with healing. Well, how does every tissue in our body heal? Well, blood flow is really, really important for healing.
Yeah.
And so part of the mechanism is sending blood to that area. Part of it, there's some ideas where it helps decrease muscle knots. And we've seen that before too, where you get a knot in the muscle, you put it in, and that knot will kind of diminish pretty quickly after you put it in the right spot. So, there's still some debates as to exactly how it works, but that's kind of a rough idea.
Yeah, I think it's very interesting because you think about, the goal, one of the goals is to actually irritate. You actually do it to irritate, and then that heals. And that's totally counterintuitive, in some sense. But yeah, blood flow it's very
I think
healing.
the whole human condition is counterintuitive. It's like everything is just so, but so how is that something? Okay, so I know a person who tore their meniscus. Okay. So instead of getting that shot, whatever, to
a steroid.
Yeah, the steroid. Would they be able to come to you? Is dry needling something that would work in a situation like that? Or would you recommend that, no, you need to go back to that orthopedic doctor and probably get the steroid shot?
So I think it depends on kind of what's going on with their knee, for example, because you're talking about the meniscus. We do know that the meniscus can heal, but the blood supply in that meniscus is also very poor. So what's really key, in my opinion, is one, we do dry needling for it if they're really having a lot of pain and irritability in that knee, and that can help decrease the pain and swelling. But what's also really important is to kind of try to figure out what might have caused that meniscus tear. What I often see causes those tears is a hip that doesn't rotate. The reason for that is when we turn or we twist with a twisting motion, God designed our hips to rotate. Our knees were not designed to rotate, but our hips were.
Right.
And so if you do a quick sudden rotation movement and your hip doesn't rotate like it's supposed to, well, our body's really good at compensating. So something's going to rotate. And oftentimes you start getting something below, either that knee or above, that low back, doing motions that really it's not designed to do. And so part of what we do for something like a meniscus tear is we go, hey, not only will we consider dry needling, but we also go, hey, how are we not moving like we're supposed to, right?
Oh,
and
that's
we want to
interesting.
fix that problem.
That's really interesting. I was a certified yoga instructor, and listening to one of and the school I went to was very, very detailed oriented. Like, it was not just the surface stuff. So we talked about the body and how certain parts of the body are hinges and other parts, you want to make sure that the alignment is straight because you put too much pressure, blah, blah, blah. And the rotating of the hips and everything. And the interesting thing about that is that most people really don't get that the slightest movement in the opposite way can cause that injury.
Well, I think it's interesting too, because when you think about a knee injury, how often do you think about, well, what's the hip doing or what's the ankle doing? The joint above and below.
Exactly. Exactly. So that's really, so in your practice, someone who was dealing with that. So what are you doing now? Are you bringing their awareness to, listen, this is the way that your body needs to be positioned when you're walking up that hill or when you're standing in place or whatever. And we're going to also start with some dry needling to see if that assists, because you said the meniscus, as the example, can heal itself. And most orthopedics, I think, will tell you the opposite of that.
Yeah. And I think most orthopedics would agree, well, it has the ability to heal. If it's going to heal, it's going to take 6 to 9, and it's going to take a while.
Yeah.
A long time.
Like tearing your hamstring.
Exactly.
I've
so
done
it can,
that too.
but it also might not, right? So that's where a lot of orthopedists, they would likely probably order an MRI and go, hey, how torn is it? Because if it's mangled in there, and depending on your age and your health, then we're more likely to potentially do some sort of surgery for it. But if it's, not as bad, and you can chime in too, if it's not as bad, we might, and depending on the patient's goal too, a lot of it's patient preference, age, health, there's kind of a lot of variables that go into it.
Yeah. I think, a lot of times when people have injuries, they think that they automatically need surgery, but that's exactly what physical therapy is here to do, is to help you try and avoid surgery, maybe by strengthening up other muscles, right? I mean, or by increasing flexibility. That joint or that area of injury will be stabilized enough that maybe you don't need surgery. Maybe you can avoid it. So
why physical therapy for you, Dr. Seitz? Why did you choose physical therapy?
Yeah, so...
Because you could have also been a pastor, right?
I thought about that at one point.
See, okay. But really, why was it physical therapy?
So back in high school, I actually rock climbed a lot. I rock climbed through all high school, a little bit into college, and competed at it. I ended up placing second at nationals, making the U.S. team at one point.
Okay.
So I was very, very good, and I enjoyed it a lot. And so throughout all that rock climbing experience, I learned my mind works really well with human movement. I can see how a body moves and how it's designed to move, and it just clicked with my brain. And getting into college, kinesiology means the study of human movement. And so it kind of just clicked. I remember my first semester was the hardest semester of my life. I failed a lot of midterms. I did not do well academically that first semester.
Okay.
But I got into a kinesiology class and I easily aced it. My professor came up to me and was like, "Hey man, you got the best grade in the class." And I was just like, wow. In that moment, I kind of realized, wow, yeah, my mind really can see human movement. That's just how it was created, is to understand it really well. So
no, I mean, I think that we're all given some type of superpower, if you will, because for me, I see in shapes. So I can automatically tell you within like a centimeter from the center of that wall, I can see that. Or I can see this line. I can see if it's straight or if it's off. And some people just have that skill set. And so for you, it sounds like it was just your natural path to be able to see the movement of the body, how that is supposed to work. And that's what led you to become a physical therapist.
Definitely. Yep.
How long have you been doing this now?
I've been a physical therapist for about 4 years.
Okay.
Yep.
Are you still how does that feel? 4 years in, having your own business, is it still kind of new? Every day you go in, or how have you grown in those 4 years, especially as a business owner? Yeah.
So I'd say as a physical therapist, it's always new, because there's always new injuries. There's always new research to learn. There's always something changing. So I'm always trying to read as much evidence-based literature as I can to help my patients to the best of my ability. And when we don't know the answer, that's the blessing that we have, is we go do some research and we'll see them next time and we can have some more information for them.
So, you have the time to be able to do that, which is very, very helpful.
Yeah.
And that's why I envy you guys. Anybody that's in your industry, because I know there's got to be a lot of research and reading, and you got to set this time aside for your patients. You also have to know the latest on, this service now is going to help heal this, blah, blah, blah.
Our patients help us to help guide us in that direction.
Well, listen, everybody, we're going to do bottom of the hour news, and when we come back, we're going to talk more about physical therapy with Dr. Seitz.
The City of Columbia's Office of Business Opportunities supports small business owners. We help minority, women, and veteran-owned businesses with loans, technical assistance, education, and advocacy. We're here to help business owners avoid mistakes. Contact us with questions and let us help. For more information, call 803-545-3950 or visit obo.columbiasc.gov. Together, we are Columbia.
Looking for the perfect gift or a little something to brighten your day? Visit A Little Happy at 707 Saluda Avenue in 5 Points. Discover unique gifts, delightful accessories, and one-of-a-kind treasures, all carefully curated by our owner, Ashley Lindler. At A Little Happy, we believe in spreading joy through every item. So come on in, find your happy, and support local. Your next favorite thing is waiting.
Are you frustrated with the healthcare system and looking for a change? Then look no further. I'm Dr. Melissa Boylan with Noretta Family Medicine. We are a direct primary care office where we take the time to get to know you. For a reasonable monthly fee, we offer transparent billing and easy-to-access primary care for all ages. Noretta Family Medicine, cutting through the red tape of healthcare. Find out more by visiting NorettaFamilyMed.com. That's NORETA FamilyMed.com.
All right, everybody, welcome back. I am so sorry. You're listening to Small Business Saturday Radio. Me, Dr. Seitz, and Dr. Boylan are in here talking about the business tip of the week. So I'm going to turn it over, of course, to Dr. Boylan.
Oh, boy, I'm on the spot here. So, I would say that, just relating to what we're talking about today, if you're having a recurrent pain somewhere, if the pain keeps coming back and keeps coming back, come and talk to your doctor, and we can help guide you in the direction of going to see somebody. You don't have to feel like you have to live with that pain. There is a way to try and treat that, and we're not, as a doctor, I don't want you to be on pain medicine for forever, but that's where physical therapy can come in, is that can help to reduce your pain long term, and then that way you don't have to take medicine.
Yeah, especially people who try to, you can't remember I was joking with you one time, Dr. Boylan, about how people go to Dr. Google, and they Dr. Google said this, and it's like, no, man, you should not be taking 50 aspirin.
Right. Oh my
because
gosh.
you don't want to have a heart attack.
Yeah.
I mean, there are some things that you need to go, bite the bullet and go see a professional.
Yeah, I think it's hard to Dr. Google musculoskeletal stuff because it's hard for us to diagnose it sometimes, without imaging. So,
but see, that's the thing. People don't know that. You know what they'll do? They'll get on there, search "my knee hurts."
Yeah.
Right. And then Dr. Google will
good
say,
luck. Yeah, there's about 50 different things that could be wrong.
Remember that time I think I told you, and I learned this the hard way. I Googled something. It's like, oh my God, I have cancer.
That is always on that list. People come to me all the time. Why are you coming in for this? I'm concerned I have cancer.
Yeah.
And I'm happy to reassure them.
And that was me Googling, my knee hurts. You have cancer.
Right,
like, oh my God,
exactly. Yeah.
It's eating away at the bone.
Well, speaking of my patients, I have to look out for them today. So I wanted to ask you, Dr. Seitz, about just physical therapy in general. So many people are not necessarily, they think they're not interested in physical therapy because they think they're just going to go and it's going to be a stretching class. So I was wondering if you could talk about sort of what you do in general to help patients beyond stretching.
Mm-hmm. Yeah, we get that quite a bit where people come in that might have had a previous experience with physical therapy too, where they go, oh, you're just going to make me kick my legs straight. You're going to make me bend my knees and stretch. And that's all it is. But I think what kind of sets us apart is our advanced knowledge on kind of the medical conditions that are occurring, our knowledge on the timeline of healing, and, developing a plan that, loads tissues in an appropriate timeline. So I guess a good way to think about it is tissues need to be loaded. Certain tissues might need to be loaded in order for them to heal. Or
what do you mean
grow.
Loaded?
Loading would be exercising a muscle, right?
Okay.
Or using a muscle. Say you have a muscle pull.
Okay.
And it hurts a lot. What do we end up doing? We end up not using that muscle. But then we're not giving it the opportunity to build back up and get stronger, right? We're just kind of leaving it weak. And because we're not using it, it's getting weaker. And it's getting weaker, it's hurting more. And so a lot of what we do is we help people develop a plan based on whatever medical condition is going on to strategically kind of load them back up to strengthen
it back up. Yeah. I mean, one other way you can think about it is, if you break a bone, sometimes you need it to put a cast on. And in that sense, there's not a lot of loading that can be done, if you're using crutches, for instance, but then slowly as time goes on, you put more and more weight, let's say it's an ankle fracture, more and more weight on that ankle and slowly kind of build up the strength. I think that's, so that it gets back to full strength. I mean, when you take that cast off, you notice that all of those muscles in there are going to be really, really weak. And so So that's, I guess another place where physical therapy can come in and really help. So, yeah.
Or another big one too is nerves running down people's legs or their arms, that sciatic nerve pain. Well, we can give you some sort of anti-inflammatory, and that sometimes resolves it. But other times there's specific movements you have to do in order to potentially reduce a herniated disc or, to get the pressure off that nerve. And so, anti-inflammatory, I've seen a lot of people where they get an injection right afterwards. They're like, wow, I feel great. And then the injection starts wearing off, and they're moving the same way they were before, and the pain comes right back.
Yeah.
And so a lot of what we do is we go, hey, the problem, we know how to kind of diagnose the problem, but then two, we help educate on, hey, you got to do more than just, medicine alone for certain injuries it's not going to fix it, right? Medicine plus movement plus therapy. That's why a lot of doctors refer out to us.
I was going to ask you about that. So, a lot of people also may come to physical therapy and think that all they need to do is what you do during a physical therapy session. So do you give people homework? Okay.
Yeah. The way I personally like to put it is, people are so busy, it's hard to get everything done. So at our practice, what we usually do is we give 2 or 3 exercises, and we call them exercise snacks. If you eat enough snacks, are you going to gain weight? You sure will, right? So if you do enough little snacks here and there, you're going to gain range of motion or strength, right? Or you're going to start feeling a little bit better. Yeah. But then when you come to therapy, we have a whole hour with our patients, and that's where we get our whole meal. Where we strengthen things a little bit more aggressively, or we might stretch a little bit more aggressively. We can work on balance. We can work on kind of everything, talk about nutrition, talk about hydration. We have a lot more time to have a whole meal in therapy. But then at home, we do just a little bit, because if I send you home every day with an hour of therapy to do, it's just too much.
Especially, I'm thinking about someone like me. That's not going to happen, And so, but I love the idea of snacks.
I like that too. That's creative.
Because that's very creative. And as soon as you said that mentally, I was like, oh yeah. If somebody told me you're going to do these exercise snacks, it's like, that's doable,
And I am kind of stealing that. There was a study that was done that looked at people's what's called VO2 max, their ability to use oxygen. And they found that people who sprinted up the stairs, 1 or 2 flights of stairs twice a day, they got a whole lot more fit in a couple weeks. Just by 10 seconds of exercise, 30 seconds of exercise. It's like, wow, just a little bit can make a really big difference.
I think that's the miracle, too, of the human body, that a little bit goes a long way, but we've been trained, I think, over generations that little means less and less means less important, right? So we keep thinking that we have to climb the whole mountain instead of just making the movement toward the top, if that makes sense.
Yeah, and I think we're all impatient too these days. So,
absolutely.
Small gains are not necessarily going to motivate people as much anymore, but that's really what can be most beneficial for you,
So what are some of the things that what kind of advice would you give people to help prevent them from having to even need your services, right? I hate to put it that way, but it's really interesting how you're talking about the rotating of the hips and how that can cause knee injuries. Are there any tips that you would give individuals to try to keep their bodies, in that healthy position and minimize the possibility of injury down the road?
So I think one of the biggest things is just to stay active, eat well. The exercise guidelines that are released say to do 150 minutes of low intensity cardio a week. So go out for a walk for 100. That's about 20 minutes a day, 7 days a week. Or 75 minutes of vigorous cardio. So going for a run, 75 minutes each week. Spread out. You don't have to do it all at once.
Doesn't running mess with your knees too, though?
Yep, it can be hard on those knees. So if somebody has knee problems, maybe swimming or cycling.
Yeah.
And the exercise guidelines also say to do 2 days a week of strength training. So I think if you're trying to prevent injury, following those guidelines are probably your best bet. Just eat well, get moving. And
can you give me an example that someone can do, with strength training? Does that require you to have to go to a gym, or I don't know, can you lift books? What if you're lifting baskets of bath bombs, right?
In your personal experience?
Does that qualify if you're lifting stuff every day? I mean, I'm just wondering.
I think there's
for
probably
a friend.
A good way to think about it is there's probably a spectrum of benefit, right? Where, hey, if I'm sitting on the couch doing nothing,
right?
What's next best? Well, if I lift up that bath bomb bucket and go up and down the stairs a couple times, well, that's probably better. Well, what's better than that is probably going to a gym and doing a circuit. What's better than that? Probably seeing a personal trainer. You know, there's probably a spectrum there that, you know, it just depends on what your goals are.
What is that called? Good, better, best?
Exactly.
Right, the good, better, best mentality.
Yeah.
Yeah, that's interesting.
Yeah, I'm kind of curious about what would you say are the most common conditions that you treat?
For us, a large percent of our patients are knee arthritis. Knees are really kind of my specialty right now. I see lots of knee pain. Hip pain's a big one, shoulder, neck, back pain. Those are kind of
when
big
you say
ones.
knee arthritis, what exactly is that? Because I think when people think of arthritis, they think about their hands, right? I don't think that people actually identify with having arthritis in your knees.
Yeah.
Right?
So if you break down the word arthritis, all it really means is inflammation in your joint.
Okay.
So your joint's inflamed, your knee's inflamed.
Due to what? You know, that's the question.
Yeah,
Exactly.
due to what?
Yeah, sometimes, I mean, the way that I think about it is sometimes it's a breakdown of something, and sometimes it's an overgrowth of something. So you can have overgrowth of bone, but you can also have a degeneration of your meniscus or
Wait
something
a minute,
like that.
your bones can keep growing?
Yeah, so if
Are
you
you
take
serious?
Yes,
Oh.
if you take an X-ray of somebody's knee, okay, and you look at it and you zoom in, one of the ways that we can tell if somebody has arthritis is if there is an extra piece of bone there that's sort of out to the side. It's called a bone spur, and that's a very common way that we help to diagnose arthritis. So,
Okay, I'm sorry. I know that was dead air. I'm sitting here with my mouth gapped open because I'm like, does it ever end? My bones are still growing. It's like, okay, all right, that's really interesting. But is there any way to avoid those types of things, like the knee arthritis or?
yeah, I mean,
We've got 15 seconds before we have to take
I think
this
that
break.
family history has a lot to do with it, but then and that's non-modifiable. But then you also have what Dr. Seitz was talking about. You have your things that you can do, stay active, throughout your lifetime. Try and become more active if you're not. I think those are some ways that you can try and avoid or having a lot of pain with arthritis.
You know, one of the things that I've decided to start doing, talking about the minimum amount of exercise, is every morning to walk for those 10, 20 minutes. Just take a walk around my neighborhood.
That's great.
Right? All right, everybody, we'll be right back.
The City of Columbia's Office of Business Opportunities supports small business owners. We help minority, women, and veteran-owned businesses with loans, technical assistance, education, and advocacy. We're here to help business owners avoid mistakes. Contact us with questions and let us help. For more information, call 803-545-3950 or visit obo.columbiasc.gov. Together, we are Columbia.
Are you frustrated with the healthcare system and looking for a change? Then look no further. I'm Dr. Melissa Boylan with Noretta Family Medicine. We are a direct primary care office where we take the time to get to know you. For a reasonable monthly fee, we offer transparent billing and easy-to-access primary care for all ages. Noretta Family Medicine, cutting through the red tape of healthcare. Find out more by visiting NorettaFamilyMed.com. That's NORETA FamilyMed.com.
Are you looking for a luxurious way to pamper yourself? Look no further than Sunrise Artisan Bath & Body. Our plant-based soaps and lotions are designed to provide you with the ultimate experience. Our products are natural and nourishing, leaving you feeling refreshed and rejuvenated. So go ahead, treat yourself with Sunrise Artisan, which is more than a bath, it's an experience. Sunrise Artisan, located at 710 Saluda Avenue in 5 Points, or online at sunrisebath.com. Sunrise Artisan.
Looking for the perfect gift or a little something to brighten your day? Visit A Little Happy at 707 Saluda Avenue in 5 Points. Discover unique gifts, delightful accessories, and one-of-a-kind treasures, all carefully curated by our owner, Ashley Lindler. At A Little Happy, we believe in spreading joy through every item. So come on in, find your happy, and support local. Your next favorite thing is waiting.
All right, everybody. Yep, and just like that, we're in the final segment of today's show. I have often said, and Dr. Boylan can also attest to this, that this show it just
flies by.
Flies by. So it's really awesome, the type of guests that we're able to interview, and I'm always learning something. And thank goodness my guests are always fascinating, as you are, Dr. Seitz. So I really appreciate you coming on the show today. And before we get into some questions that Dr. Boylan has, use your words, Tazima. I need you to let the audience know how they can reach out to you. If you can give us your website, your telephone number, and let them know how they can make contact with you.
Thank you. Yeah, so our website is alive-pt.com. If you just Google Alive Physical Therapy, we'll pop up. We're in Northeast Columbia, South Carolina on Hardscrabble Road. Our phone number is 803-728-1133.
You might want to give that number out again.
Yes, it's 803-728-1133. And
you're up by the Publix on Hardscrabble, right?
We're in that Publix parking lot. So if you go into that parking lot and take a right between Pizza Hut and the nail salon, we're right back there.
Publix, Pizza Hut. Those are my two favorites.
Well, now Alive Physical Therapy right there in the middle, too.
Yeah. So Alive here there is a good sign. So, okay. So, yeah. And people can, what are your office hours? Like you guys are traditional Monday through Friday. And what are your hours?
We're right now open from 7 a.m. to 5 p.m.
Wow. That's early.
Yeah. It's very, very early. But
very early.
Yeah.
Do you have to use do you have equipment and all of that stuff, or is everything like hands-on? You know what I mean?
Yeah.
Like, yeah.
It's kind of a combination of both. A lot of it's hands-on.
Okay.
And we do have a lot of fitness equipment in there too. Some weights, a treadmill, a bike, some other really cool high-tech equipment as well.
Oh, wow.
So,
Okay. Dr. Boylan, I thought you had a really good question during the break.
Yeah, so I have kind of a hot topic question. So I've had some patients come in and ask me about remote sort of tele-physical therapy. And I was just wondering, Dr. Seitz, what your opinion is on this, about the possible benefits versus the risks of it. So,
for the right patient, it might be great. However, it's... there's certain things you wouldn't be able to do through telehealth. For example, I can feel what a joint feels like when I put my arms in there and I kind of passively move their joint. You can't do that through telehealth. I can feel what their knee feels like, if it's hot, if it's swollen, if it's where the tender points are, and you can't do that through telehealth.
That's right.
Yeah.
If somebody has a balance problem, it's not safe to check their balance through telehealth. You need to be right there next to them in case they fall, right?
Yeah.
So
what are some of the conditions that you think might be appropriate for it? I'm just curious about that.
Potentially, the main scenario I could see it working well with is if somebody came from the hospital and was deconditioned.
Okay.
Not necessarily an injury. Maybe they had a UTI. They got really weak, and they're having, just trouble at this point.
Wait, you can get weak from a UTI? Are you serious?
So if they're in the hospital, you get weak pretty quick.
Yeah.
Oh, wow.
And the caveat to that would be I'd want there to be somebody with them at home. Right?
So it would require somebody else. Yeah.
So for the most part, I wouldn't probably recommend it unless there was somebody highly motivated to help our patients at their house, to be right there next to them. And even that, I wouldn't recommend it. I'd say, hey, it's better if you can come to the clinic, or if we can send a therapist to your house.
You know what's crazy? Okay, so I'm probably oversharing, but the way I met Dr. Boylan, I had to have emergency operation. They had to take my gallbladder out, and I'm just thinking about how you were talking about how people get weaker in the hospital. And for me, being in the hospital is the worst, right? Because I'm so independent. I just laying in bed is like, and I will never forget, it wasn't even a week when I was released from the hospital, so I have all these stitches or whatever it is they close your stomach up with. So I've got this bandage and everything. I'm in my house and I look in my kitchen and all of a sudden I decide it's disgusting and I need to paint it. Okay? It's like, so I get my son to go buy paint and I'm sitting in the chair with stitches. Wow. Painting my kitchen. And my son is like, Ma, you gotta stop. It's like, you can't do this. And I think that's how I probably, now I'm not recommending anybody do this. I think I don't know boundaries sometimes, but I really think that's how I heal quicker.
Well, sometimes it is, right? Sometimes it is about getting out there and doing and pushing yourself a little bit, but you also have to know where the line is. We didn't want you to pop those sutures, stitches.
But what I did, I sat in the chair, right? So the lower cabinets, I was sitting in the chair, and if it's really low, I got my son to outline that and everything. And then the top part, I just used a really long.
You just can't not be busy to do that. That's what it is.
I know there's something wrong with me. We need to have a psychiatrist on the show.
Well, what you bring up is actually kind of interesting too, because medicine and healing has kind of followed that same pattern where when somebody used to have a pelvic fracture, we used to put them in bed for months and we might put them on traction where we put rods through their legs and pull their legs down from their waist. And we don't do that anymore. We now go, hey, let's get you up and walking as soon as we can. Sometimes they need surgery, but oftentimes we go, wow, the sooner we can get you up and get you moving.
Yeah.
Or a knee replacement. Now we're getting people at the same day of a knee replacement. So what we're learning is the faster we can get people up and moving after an injury, appropriately too. That's where therapy or your physician comes in. Sometimes you need to not move too much, but there's other times where we think we shouldn't move, but really we should. We should move. Right?
You know what? And I really do think I'm one of those people where I did tear my meniscus, and I ended up getting a steroid shot. And the doctor really thought I would be back in 90 days. My knee was fine for a year. And then after that, I had to get another shot. And again, it's been almost a year and there's no issue. But I'm just listening to you, Dr. Seitz, and listening to Dr. Boylan. I really think, and I'm only speaking for myself, I think it's because I don't stop. And I'm not saying if that's good or bad. I'm saying for me, it seems like because I will keep going.
Yeah, I think this is a really, really good point. So many things play into your health, right? So it's not only your physical health, it's also your mental health, and sort of your experiences in your lifetime, and that sort of, helps to determine what you're doing with your body every day. And so, all those things play a role, and can contribute.
And I love the way you guys are talking about that. Old school was, just lay in bed and rest. Right,
after a heart attack, that was another example. People would lay in bed for months.
Right, and only to find out that actually, and then I'm sure it's case by case, but in most situations, the last thing you want to do is stop movement. Because the body, if you think about it, the body isn't even designed to stop movement.
Yeah,
the body requires movement, right? So resting is one thing, but that's why you were talking about physical snack exercises, or, me talking about walking in the mornings, or Dr. Boylan talking about the importance of your wellness and recognizing what's going on in the body. But the body is not designed to just lay there. That's called death, right?
Yeah. So I have a question, since we brought up walking a couple of times.
2 minutes.
Yeah. So what is your opinion of walking? Being you've been to our Walk with a Doc events in the past, and we appreciate you coming out. So how helpful do you think walking is?
Very, very helpful. Yeah, I would recommend. Anyone and everyone do it. Yeah. We, hundreds of years ago, that wasn't an option. And so I think that's where a lot of the injuries are coming from. We're seeing today is we're sitting more than we ever have. Our posture, sitting, driving, we sit a lot.
That's right. So, that's another good point. We drive everywhere. Yeah. Okay, so now, Dr. Boylan, we have like 2 minutes. You've got to talk about Walk a Doc.
Okay.
Okay.
Yeah, absolutely.
Really?
Thanks.
And let people know how they can.
I came straight here from there
with your
today.
T-shirt on and everything.
Exactly. But yeah, Walk with a Doc is we have a Columbia chapter of Walk with a Doc, and what we do is we meet down at the Saluda River Walk, which is by the zoo. So if you go down Greystone, you go to the T, you go right onto Candy Lane to get to the Saluda River Walk. Second Saturday of every month at 9 a.m., you'll see our tent or our posters, or we've got some things out there. We've got free T-shirts for our new walkers, and we do a quick health talk for 10 to 15 minutes, and then we walk for an hour. However, you can go at your own pace. You don't have to set a goal of walking the full 3-mile course, but yeah, it's just a way to help educate and empower people, and also to create a social activity for people to do.
Well, considering your favorite patient has to be in the studio every Saturday,
that's why I come and talk about it.
Have you guys ever thought about being able to add to that, though, or is that just something that's impossible?
We would love
right now?
to. We would love to. It's just it does take some time for us to kind of put the put the
get
walks
it together and have everybody.
Yeah. But it would be nice.
Because I would think one in the evening.
Yeah, I know. Different times.
Nice.
I know. We'd love to do it. It was beautiful this morning.
Oh yeah, it's beautiful outside today.
Nature is so healing. So,
yes.
We need to utilize what.
And I think that's the other thing we have to consider too is the role that nature plays in our lives. That so many of us are inside all the time. Like I realized one of the reasons why I was so tired was because I was getting absolutely no vitamin D. I would go from my house into another building, leave that building, and go back to my house. Yeah. And it's like, no, you have to get some sun. You have to, be out in nature. I mean, that's why it's there. So, you know what? The show is ending. And I was just on a roll, too. So, Dr. Seitz, thank you so much. Alive Physical Therapy. Everybody check it out. Dr. Boylan, thank you.
Thank you.
And you guys have a great weekend.